In getting the blood pressure, locate your pulse by lightly pressing your index and middle fingers slightly to the inside center of the bend of your elbow. Next is secure the cuff and place the stethoscope in your ears. Then tilt the earpieces slightly forward to get the best sound. Using a manual monitor, inflate and deflate the cuff by holding the pressure gauge in your left hand and the bulb in your right. Close the airflow valve on the bulb by turning the screw clockwise. Inflate the cuff by squeezing the bulb with your right hand. You may hear your pulse in the stethoscope. Watch the gauge. Keep inflating the cuff until the gauge reads about 30 points above your expected systolic pressure. At this point, you should not hear your pulse in the stethoscope. Keeping your eyes on the gauge, slowly release the pressure in the cuff by opening the airflow valve counterclockwise. The gauge should fall only 2 to 3 points with each heartbeat. Listen carefully for the first pulse beat. As soon as you hear it, note the reading on the gauge. This reading is your systolic pressure. Then continue to slowly deflate the cuff. Listen carefully until the sound disappears. As soon as you can no longer hear your pulse, note the reading on the gauge. This reading is your diastolic pressure. Allow the cuff to completely deflate. Lastly, record your blood pressure. K test. Take the patient's blood pressure and record it. Next is inflate the cuff to a point midway between the systolic blood pressure and the diastolic blood pressure and maintain it for 5 minutes. And reduce and wait for 2 minutes. Next is count the petechiae below the antecubital fossa. A positive test is 10 or more petechiae per 1 square inch. How to measure your respiratory rate. To get an accurate measurement, sit down and try to relax. It's best to take your respiratory rate while sitting up in a chair or in a bed. Measure your breathing rate by counting the number of times your chest or abdomen rises over the course of 1 minute. Record this number.
On the next videos, I will show you on how to get the different pulses. The first is the apical pulse. Explain the procedure and secure consent from the patient. If visible from inspection, palpate for the apical impulse using the tip of the right middle and index fingers. While palpating the visible apex beat, palpate for the angle of Louis with the other hand. From the angle of Louis, slide fingers laterally to the left parasternal intercostal spaces and determine what intercostal space the apex beat is located and record. Temporal pulse. Face the sitting or recumbent patient. Use the index and middle fingers to feel the zygomatic arch in front of the patient's ear, specifically near the small pointed eminence on the right side. Move fingers slightly above the zygomatic arch to feel the pulsation of the temporal pulse. Locate the temporal pulse on the left side using the same technique. Simultaneously palpate the temporal pulses on both sides and record. Carotid pulse. Position the patient sitting or if supine, elevate the trunk about 30 to 45 degrees. Elevate patient's chin and turn face to the left side without tightening the neck muscles. Inspect for visible carotid pulsations. With index and middle fingers, locate the right carotid artery by palpating between the trachea and the anterior border of the sternocleidomastoid muscle at the level of the cricoid cartilage. With your other hand, bend the patient's head slightly to the site being examined. Apply varied degrees of pressure in palpating the pulse until the maximum pulsation is appreciated. Draw the carotid artery pulse as part of auscultogram. Record finding. Radial pulse. Position the patient's arm in a relaxed position, palm downward or upward. Both are correct. On top of the table, or the patient's upper thigh or supported by your other hand. Locate right radial artery using the pads of your index and middle fingers aligned longitudinally over the course of the artery by applying gentle but firm pressure in the medial and ventral side of the patient's wrist just below the base of his or her thumb. Do not occlude the radial pulse. Count the pulse rate for 1 full minute using a watch with the second hand, initially on the right side. And record. Face the sitting or recumbent patient. Support the patient's forearm with your left hand. With the patient's right upper arm abducted, the elbow slightly flexed, and the forearm externally rotated. Palpate for the patient's brachial artery with your right hand. Use the pads of your index and middle fingers curling over the anterior aspect of the patient's elbow to apply gentle but firm pressure to palpate along the course of the artery just medial to the biceps tendon and lateral to the medial epicondyle of the humerus. Note any thrill and record. Tibial pulse. Put the patient in the supine position. Stand at the foot or the side of the examining table.
Use the pads of the index and middle fingers to locate the right posterior tibial artery by applying firm pressure anteriorly around the ankle, indenting the soft tissues in the space between the medial malleolus and the Achilles tendon above the calcaneus. Apply your thumb to the opposite side of the ankle and a grasping fashion to provide stability. Then record.
Pedis pulse. Put the patient in the supine position. Stand at the foot or the side of the examining.
Use the pads of the index and middle fingers to locate the right dorsalis pedis artery by applying firm pressure on the median dorsum of the foot. Use the other hand to dorsiflex the foot to various degrees to separate the dorsalis pedis artery from the tendon overlying it. And then,
Radial pulse. Put the patient in the supine position. Place the fingers of both your hands in the popliteal space of the right leg with the palms in complete contact with the patient's skin, including the anterolateral aspect of the knee. Relax the muscles around the popliteal area by bouncing the knee.
with firm pressure, squeeze with the entire hand, providing an equal sensation all through the hand. Slightly dorsiflex the patient's foot to stretch the popliteal artery to bring out the transmitted pulsation. Pressly dip into the popliteal fossa to palpate for the popliteal artery. Record. Use the pads of the index and middle fingers to locate the right femoral artery by applying firm pressure at a point inferior to the inguinal ligament midway between the anterior superior iliac spine and the symphysis pubis. Note any thrill and record. Capillary refill time. First is remove the finger rings and nail polish, if any. Second, apply pressure to the nail bed until it turns white and record the time taken for the color to return. Note that it normally takes 2 seconds or less, but when it takes longer, the arterial insufficiency is suspected. Record your findings. Always compare your result to the normal side of the hand or fingers. Throat examination. Palpation of the thyroid gland anteriorly. First is you have to explain the procedure and secure consent to the patient. Stand in front of the patient and relax neck and hold it in slight extension. Locate the thyroid isthmus directly below the cricoid cartilage using the pads of the thumb and index fingers. Ask the patient to swallow, that will cause the isthmus to rise, nothing for its rubbery texture on palpation. Place your fingers laterally anterior to the sternocleidomastoid muscle of the neck and ask the patient to swallow to feel any mass or bulge on the lateral lobes. Palpate first the left thyroid gland lobe by asking the patient to tilt his or her head slightly forward and to the right. Use the left thumb in displacing the thyroid gland in a left lateral position while palpating the left lobe with your right thumb and index finger afterwards, and ask the patient to swallow. Lastly, repeat this procedure on the right lobe. Palpation of the thyroid gland posteriorly. Explain the procedure and secure consent to the patient. Stand behind the patient who is seated with neck slightly flexed to relax the muscles. Put your thumbs on the back of the patient's neck as you place your fingers below the cricoid cartilage, palpating the thyroid isthmus above it as you ask patient to swallow. Ask the patient to turn his or her head slightly to the side and palpate the lobes. Use the fingers of the opposite side to displace the gland in a lateral direction so that the fingers over the side being palpated can more be readily felt as the patient is asked to swallow. Repeat the procedure on the right lobe. Ryan's test. Explain the procedure and secure consent to the patient. Sit the same level or slightly higher than the patient. Strike the tuning fork. Place it firmly against the patient's mastoid process. Ask the patient to tell the buzzing sound stops and note the duration. Immediately move the still vibrating tuning fork near the external auditory meatus of the patient. Ask the patient when the buzzing sound stops and note the duration. Compare the duration of the bone conduction versus the air conduction and interpret the findings. Weber's test. Explain the procedure and secure consent to the patient. Sit the same level or slightly higher than the patient. Strike the tuning fork. Place it firmly against the middle of the patient's forehead or on top of the head at the midline. Ask the patient where the sound is heard, whether the sound is heard equally in both ears or there is lateralization, and interpret the findings.